Lung cancer is one of the leading causes of death for Americans, and it's actually more than breast, colon, and prostate cancers combined. And when it comes to treatment, chemotherapy can be a battle within itself, but there may be some hope on the horizon with a newly FDA-approved treatment. Joining us now to tell us more is Dr. Vincent Lamb to really help us dive into this topic. So Dr. Lamb, first let's talk about this new treatment and how it's going to impact a patient's experience.
So many of us have seen loved ones struggle with the side effects of chemotherapy, or perhaps have even personally experienced it, themselves. So these side effects often include hair loss, significant fatigue, low blood counts, which can be life-threatening. So we're really excited to have a new drug that can help reduce some of these debilitating side effects, thus making chemotherapy potentially safer and more tolerable for our patients.
So I think you've got a lot of people's attention when you say that. Most of us have some level of relationship with cancer in our family or friend group. So can you talk more about what that treatment entails?
Yes. So in general, chemotherapy works by killing the fast-growing cells in our body. So these are exactly the cancer cells that we're actually trying to target. Unfortunately, there can be some collateral damage in that good cells are often impacted, such as your white blood cells that can fight infection, or red blood cells that help carry oxygen throughout our blood. This new treatment is given before chemotherapy is started, and in a way it temporarily puts these good cells to sleep so that they can be protected from the collateral damage.
Okay. Are there other treatments in research?
Lung cancer research is happening every day. I often tell my patients that we've made more progress in lung cancer in the past 5 to 7 years than the previous 30 years combined. So on the whole, our patients with lung cancer are living longer than we've ever seen, and that's because of research. For example, one major advance is that we don't use a one-size-fits-all approach anymore in lung cancer. By personalizing treatment for a patient's specific tumor, we're able to achieve much better outcomes.
I think a lot of people are going to be very happy to hear this, Dr. Lamb. How important is this new treatment for lung cancer patients who are diagnosed with small cell lung cancer? And is there research to see if this treatment could benefit other types of cancers?
Yes, it's really important for our small cell lung cancer patients because chemotherapy is such a critical part of our treatment for that disease. Although I think it's important to note that as many in your audience may know, small cell lung cancer and lung cancer in general actually does not affect only smokers. It affects non-smokers as well. So it's really critically important that we have these new treatments for a disease that impacts a major part of the world, really. This chemoprotecting drug is currently FDA approved for small cell lung cancer, but there are clinical trials that are ongoing to investigate this approach in other cancers as well, such as breast cancer, colon cancer, and bladder cancer.
Now, the question that really benefits people at home watching, where can people go to learn more information?
Yeah, so firstly, I think it's a great opportunity to have patients discuss this option with their doctors to see if it's something that might be helpful for their particular situation or if they can participate in one of these clinical trials. We're partnering with an amazing patient advocacy organization, Lung Cancer Foundation of America. So you can go to their website for more information. It's lcfamerica.org.
All right, Dr. Lamb, thank you. We'll also add that you can text LCFA to 41444. Thank you so much.
Thanks again.